Hi, I'm recording a demo for you today of the triage physician steps within the Oncology Referral and Triage workflow. For the purpose of today's demo, the receipt of the faxed referral package, the indexing of documents to the chart, and updating the referral status to ready for triage have been completed by the clerk, so I will not be reviewing those steps. When the clerk updates the referral status to ready for triage, it routes the patients to the dynamic work list for the triaging physician to review. So I'm going to go ahead and log into PowerChart as an oncologist, and it will open up to Message Center. From here, I will click on the dynamic work list here at the top, which is the main routing tool that will be used by the triaging physician. What makes it dynamic is it does update in real time by filters or fields like the one I mentioned when the clerk updates the referral status to ready for triage. Because of where we are in our build, we're using the location of LGH. So here the triaging provider at LGH Chemo Unit is looking at patients with a GU cancer diagnosis who are ready for triage. I just want to mention that these patient lists will be configured during training prior to the go live. So if triaging referrals is part of the provider's role, they will be taught how to create these patient lists. So we can see 2 patients on our list that are ready for triage, and I'm going to click on Diego. That will open up his chart, and before I do, I will need to assign a relationship to this patient because it's the first time I've opened their chart. So I'm the triage provider, and I've double clicked on it and it should open up to the chart. Here we are to the provider's view. And here the provider's view, we're looking at summary view pages, also referred to as the M pages. So along the top here, we'll click on the Oncology Triage M page. So here is a summary view of Diego's chart. It will pull in information from the chart, so if there were any labs or imaging or pathology. Because this is a new referral, the majority of the information will live under the Documents component here. Unfortunately, our Documents component is displaying 0 because at the time of recording this demo, the indexing of documents is offline as we're preparing to set up the system for Group 1. So when the referral clerk is indexing the documents, the outside pathology, the outside labs, anything part of that referral package will live under the Documents component. The triaging provider could also link out to Care Connect here at the bottom of the menu, and it will link out to the patient's chart, and the triaging provider could review additional information. For Diego, we're going to assume there was no missing information and an order can be placed by the triaging provider for this patient to see a medical oncologist for the discussion of chemotherapy. So we will open the Orders M page, which is located beside the Oncology Triage M page. And here we'll see different orders that the triaging provider could place, from triage all the way down to imaging orders. For this patient, the triaging provider would like for this patient to see medical oncology within 2 weeks. So we can see the orders broken out by priority and specialty, from medical oncology to radiation oncology and then surgical oncology. We're going to place an order for this patient to see medical oncology within 2 weeks. You see here that it's all displaying in white and our shopping cart is empty. When I click on the order, it's going to highlight it in green, and our shopping cart is highlighted by green, indicating 1 order here. I'm going to click on my orders for signature, which is the shopping cart. I see my oncology new patient order, and before I sign it, I do want to modify it. I want to modify any details for the scheduler. I'll click modify, and here it's indicating it's in an ordered status, and there are missing details, which we can see by the blue circle and the white X. We can go ahead and click on our order, and the details for this order appear. Again, our location is the LGH Chemo Clinic. We can see from the order the physician specialty along with the priority have populated. And then the required fields are indicated by yellow. So the reason for the referral, which is chemotherapy, the tumor site, we're triaging GU cancers. If the triaging provider would like to refer this patient to a particular oncologist, he or she could indicate it here, and also any special instructions. Perhaps the triaging provider noted patient is not available for morning appointments, so I could indicate to the scheduler to please book an afternoon appointment. If there were additional comments that needed to be made, I could also use the order comment and type any details in here. I am going to go ahead and sign my order, which is at the bottom of the screen. I'll click on sign. And it takes us back to the provider view. I can look at my order. And we can see that the oncology new patient appointment is now in a future on hold status. So when the oncologist, or pardon me, the triaging physician places the order, it will send a scheduling request to the scheduler at the clinic to book an appointment with the oncologist, which is indicated here. So signing it, sent it to the scheduling queue, and it tells us that it's ready to be booked. So if I go back to the provider view, I can go up to the dynamic work list. So for Diego, we placed our order. There's nothing additional we need to do with Diego. Because we placed the order, he should fall off our list. So when I go and refresh the screen, Diego should fall off, which he did, and we're left with our one patient. So now we can go into Woody's chart. I will click on his name. Now I have accessed Woody's chart earlier today, which is why it did not ask me to assign a relationship. Again, we're at the provider view and the summary pages, also referred to as the M pages. We will go to the oncology triage. As a referral, most of the information will live under this documents component. We can also link out to Care Connect as mentioned with the last patient. In this scenario, we'll pretend that there was missing information. Perhaps there was a missing CT report. So I'm going to go to my orders, M page. I will click on it. I'm going to minimize the oncology new patient orders. And I can see in the triaging orders that there's an oncology hold referral. So I'm going to expand that list. And again, we can see different reasons for the hold referral. A hold referral pending a path review or a path report, an appointment with a surgeon, and as per special instructions. So as per our special instructions, we have the missing CT report. So I'm going to select this oncology hold referral. I'll click on it. Again, it displays in green, and there's one indicated in our shopping cart. I will click on the shopping cart. Again, before I sign, I need to modify and indicate any details for the clerk. I will click on my order, and I'm going to write in the special instructions, missing CT report. The reason our referral is on hold, as per the special instructions indicated here, and again, any other comments I could indicate under our order comments. So here I am going to go ahead and sign this order, and it will take us back to the provider view. We can go to our order screen and see that that order was indeed placed. I'm going to go back to the provider view to highlight from here, I'm going to click on the Oncology Triage M page. And I want to make note that I did request a missing CT report in case I'm not the triaging provider when we receive that CT report. So here we see the arrow down, or the upside down triangle, and it displays the Oncology Referral Triage. So this is the multi-contributor power form. earlier today I went ahead and made some notes on Woody so we can see how it displays. So the previous triage communication notes. I indicated that the radiation oncologist reviewed this and would like to possibly offer the patient radiation after chemotherapy. And then on November 20th, the referral clerk sent it to medical oncology. So here I'm going to indicate the date, November 20th, 17, missing CT report requested. I'm going to sign it. And then I'm going to go ahead and click the green check at the top to sign it. We can go and click on the triage component, and beside the triage component is the upside down triangle. I will click on that to open the Oncology Referral Triage Power Form. And we can see the most recent note displaying at the top, November 20th, the missing CT report was requested. So any communication regarding the triage of this patient can be captured on this Power Form. I'm going to go ahead and X out of it. I want to cancel charting, yes. And I'm going to go back to the dynamic work list and again refresh, and we should see Woody drop off. So the triaging provider has triaged